How many consultations are you doing a week for the All-On-4, All-On-X dental implant supported arch in your clinic? Matt Griffin here, Smile Mentor. In this series, we are talking to clinicians about learning through the mind of the clinic, and plus also gleaning from our experience with working with multiple clinics across this nation, being a KOL for MIS and Dentsply when it came to the business development and marketing side of things, and as a patient who now has had the procedure done and his own mom. You know, that's where we're coming into this from. And so in this series, I want to help you really grow in that patient base. I want you to get more patients. And that's why I ask, how many consultations do you have? A week, a month? The more you have, the more you realize how prepared you need to be. So if you're on that lower end, it doesn't matter. Strike that. No matter where you are on this spectrum, I believe this is going to help you out. Get your team ready. Everyone, front desk person, your dental assistants, your hygiene. If you have lab guys, your lab guys, your office manager, your business manager if you have one, your spouse. Golly, guys, here's a nice little tidbit for you. Please, if you have your spouse working there, or he or she comes up to the clinic a lot, make sure they know they're walking into a place that serves patients. That's your whole focus. And so by getting your team ready and everybody focused on that patient that comes through the door, that your front desk, they know that patient by name. They know they're coming in at 11:15. Mrs. Jones, they come in. Mrs. Jones, welcome to ABC Dentistry. We're glad you're here. Have some paperwork for you. Make sure they're welcomed initially when they come in. Make sure that dental assistant, when they come to take them back, that they smile, that they know the patient's name, they call them by name. If it's a consultation and it's a first-time consultation, oh my gosh, make sure that assistant knows the rounds. What do I mean by that? Hygiene, any general ops, show off your sterilization. If you got a lab, show it to them. Give them a tour. They are investing in everything you're showing them through trust and their own money to see if you're going to serve them. That dental assistant, when they take that patient back, don't help them know who they're talking to. I mean, I've talked to some of these really young dental assistants that I know they're hungry and just somebody hasn't trained them. It's not their fault, but they just act like, they're in a world that's stuck in this, right? Some of that generation, and yet not to throw the baby out with the bathwater, I've met some really good, that are hungry for training, young assistants that take the time with that patient, especially on that first consultation. Can they get them any water? Do they need to use the restroom? Do they need to show them the restroom? Are they comfortable? Have you guys invested in low dose radiation CBCTs? Please do, especially for these kind of patients. We've had a lot of exposure to radiation. And so, giving the patient that tour, explaining about what is going on. They're scared, they're nervous, help ease those fears. And then once they get back to that chair, please, unless it's an emergency, doc, get in there quickly. Take some time with them. Spend the time. I'm not gonna belabor this part of it because I've covered that in another video in this series, but please take the time. And I'm going to really tell you something that I've seen is pervasive in the dental world. You guys love to charge the price, but you also like to hide from it. You have others do the bidding when it comes to talking about money. I get it, it's uncomfortable. You're asking that patient to give you a car to fix their teeth, and a pretty decent car too at that, especially if it's a full mouth. I get it, but are you worth it? Are you worth it? If you are worth it, then don't be scared to tell them how much you're going to charge them, because why? It's an investment. This is an investment into the rest of their life. If you're good at what you're doing, okay, and you're charging a decent price, which we covered in a different video, be confident. Don't run from it, and be all inclusive. Don't do the nickel and dime thing. Hey, here's what it is. Per arch, 4 implants, 6 implants, don't care. Bone graft, no bone graft, don't care. Give them an all-inclusive price, because when you start nickel and diming, oh, guys, that's just cheap, and we smell it a mile away. And I tell patients, please don't fall for that. Look at the fine print. Ask what you're getting. This is what I tell the patients. Ask what you're getting and what additional costs. I understand there's extenuating circumstances, and sometimes there's a need for that. But as a whole, don't be afraid to talk about the price and make it all inclusive. Walk them to the door. Even when you're handing it off to the dental assistant, walk them to the door. Stand up, greet them, shake their hand. Please, the more they can bond with you, the more successful you're gonna be. I don't care if some of this gets in your knickers a little bit. I'm trying to help you. I really am. I want to see the kind of clinicians out there that can treat the patients this way. Again, my own 2 cents, and it's a word to the wise. Our goal is through this to have patients that are looking for you. You want them to find you. This is what I am telling you is what they're looking for. So I hope you heed my advice and really take some of this to heart. And you know what? I know there's some of you out there that are already doing this. I watched it, and I'm telling patients, go find them. They're hungry for you. So for those, good job. Keep up the good work. Thanks for joining us, guys.